Chapter 1: Community and Public Health Organisations for Promoting Health and Healthy Eating Habits, an Overview, by Lenny Caius. Public health refers to all organised measures, whether public or private, to prevent disease, promote health and prolong life among the population as a whole. Its activities aim to provide conditions in which people can be healthy and focus on entire populations, not on individual patients or diseases. Thus, public health is concerned with the total system and not only the eradication of a particular disease. Community health organisations operate across the state and aim to provide a broad range of services and health promotion activities to local populations, particularly those who have or are at risk of the poorest health and have the greatest economic and social needs. There are approximately 100 community health services in Victoria, operating from approximately 350 sites. Community health services sit alongside general practice and privately funded services and other health and support services. Table 1 shows a comparison between public health and community health organisations. CoHealth is a new and developing organisation. It is a combination of 3 prior community health services, including North Yarra Community Health, Dudagalla and Western Region Health Centres. CoHealth has many services that provide healthcare, specifically promoting health by the nutrition programs as well as individual consultations. These include Cafe Meals Program, Market to Kitchen, and individual consultations that may vary from general healthy eating to specific conditions. The barriers to healthy eating are multifactorial. These include low health literacy, food security and safety, financial priorities, substance use, education, food and nutrition knowledge, and taste and portion size. The barriers to healthy eating habits may be reduced from an organisational perspective. CoHealth have the following initiatives. Internally, healthy catering guidelines which provide a safe and healthy eating environment, and they have a staff wellbeing committee. Externally, they have a Cafe Meals Program, which is a subsidised meals program, outreach dietetics targeted at people unlikely to access mainstream dietetic services, community garden and cooking skills programs from market to kitchen. The Victorian Government outlined the elements required to provide a successful community health service. The community-based model of care supports community capacity building to promote health and well-being, to encourage consumer participation in service planning, delivery and evaluation. Strong community health service means a strong consumer-focused model of care, which can be provided across the community-based interface, which strengthens the capacity for partnerships with other sectors that influence the health of individuals and populations. Central City Community Health operates under guiding principles to ensure a solid framework for delivery of care. Overall, CoHealth meets most of the performance criteria that indicate a successful service. The aforementioned self-directed evaluation and a solid organisational framework facilitate this. Recommendations for improvement include to provide a weekend service and to invite consumers to participate in the managerial decision-making process. It is integral to be a culturally competent practitioner, as they can provide patients with active listening, be aware of groups' health and nutrition concerns, and be guided by Learn, which is an acronym that stands for Listen, Explain, Acknowledge, Recommend and Negotiate, and give individualized nutrition advice. Cultural competence is critical in provision of healthcare as it assists with building rapport, providing individualized care and appropriate and relevant interventions. At CoHealth, accredited interpreters are provided